Hi, my name is George, and thank you for selecting Clarity Senior Care as your senior care education provider. We strive to give you unbiased advice and insight to help you navigate your senior care needs. The information provided in this module has been gathered through many interviews from caretakers in the field, as well as through personal experiences of decision makers involved in the senior care process. In this video module, we will seek to give you a high-level understanding of what managed care is and how it works within the context of funding you or a loved one's senior care needs. As far as the textbook definition, managed care is a type of health insurance plan that attempts to manage the quality and cost of medical services that individuals receive. The vast majority of Americans are in some form of managed care plan, as more than 3/4 of Medicaid enrollees are covered under managed care plans, and 31% of Medicare beneficiaries were involved in managed care plans. Managed care is typically administered by private health care insurers such as United Healthcare, Humana, and Cigna, to name a few, and will typically limit the number of healthcare providers from which a patient can choose from. Specifically, these managed care organizations will have arrangements with certain physicians, hospitals, and healthcare providers to serve patients who are plan members at a contracted, reduced rate. However, the choice of physicians, drugs, and treatment are typically restricted within a network. The network will consist of anything from a specific hospital system, primary care physicians, medical specialists, and certain skilled nursing facilities. These managed care organizations will seek to have a network of preferred providers in order to help keep out-of-pocket costs lower than traditional healthcare plans. Some managed care organizations will even allow healthcare procedures to be covered even if the healthcare provider is out of network. However, this dynamic will differ based on the insurer sponsoring the plan, as well as which state you are in. A managed Medicare and managed Medicaid plan is unsurprisingly administered through a private health insurer to allow you or a loved one to more easily receive and manage your healthcare benefits and coverage. For example, in Texas, the Texas Health and Human Services offers the STAR Medicaid Managed Care Program to help individuals select their healthcare coverage plan depending on where they live. Although Molina Healthcare, Aetna, and Cigna are managed care organizations that offer healthcare plans to choose from in Texas, Amerigroup is the most popular managed care organization in the state of Texas. Ultimately, the purpose of a managed care plan is to reduce the cost of healthcare services by stimulating competition and streamlining the administration of the care provided. These managed care organizations will contract with a group or panel of healthcare providers. Health maintenance organizations, or HMOs for short, as well as preferred provider organizations, or PPOs, are examples of these types of contracts. The healthcare provider typically receives a set amount of money each month based on the number of individuals covered by the plan. As we mentioned before, the private health insurance companies will administer certain managed care plans which can offer various options to pay for senior healthcare services. Specifically, these managed care organizations, such as United Health or Humana, can provide Medicare supplemental insurance, which is used to help pay for certain services not covered by Original Medicare or Medicare Advantage, which tends to be a more comprehensive healthcare coverage plan for seniors. Medicare Advantage, as referenced in our Medicare and Medicaid video module, falls within Medicare Part C and allows patients to choose a health plan with at least the same coverage as Medicare Parts A and B, and oftentimes covers even more services than original Medicare Parts A and B. To jog your memory, Medicare Part A covers inpatient services such as hospitalizations and skilled nursing care, while Medicare Part B covers outpatient services, which often covers specialty physician treatment and some home healthcare services. Medicare Advantage programs also provide benefits of Medicare Part D, which covers self-administered prescription drugs and will always have an annual out-of-pocket spending limit, which original Medicare Part A and Part B lack. Specifically, the annual spending limit detail under Medicare Advantage will cover any healthcare costs above a specific out-of-pocket amount. It is important to note that Medicare Advantage plans differ depending on what state you live in and which private healthcare insurance is sponsoring the plan. Some Medicare Advantage plans will require that you pay monthly premiums, while others will not require that you pay a monthly premium, but will require that you pay certain co-payment amounts depending on whether you're making a hospital visit, primary care physician visit, or a visit to a medical specialist, such as an oncologist or an orthopedic surgeon. We advise you to visit or call your private healthcare insurer to learn more information with respect to their sponsored Medicare Advantage plan. AARP provides a Medicare Advantage plan through private insurer United Healthcare, where you can call 1-844-218-8079 or visit their website, www.ma.aarpmedicareplans.com, where you could learn more about when and how to enroll, as well as learn more about coverage and payment details. Thank you once again for selecting Clarity Senior Care as your senior care education provider. We truly hope the information provided in this module was informative and has helped you gain the knowledge and insight to make informed healthcare decisions. Please do not hesitate to contact us via our chatbot if you have any questions associated with this specific module and the senior care process in general. Please feel free to check out our other senior care related modules in the beginner and intermediate video module sections of our site. Finally, if you or a loved one needs immediate consult regarding any aspect of the senior care process, please feel free to call us at 1-800-818-8710.